from the mid-humerus down, that is considered the upper extremity, okay, technically, and then from the upper humerus up, including the clavicle and sternum, is going to be the shoulder girdle. Okay, so we'll cover that in another chapter. So with the hands, we have 14 phalanges. The phalanges applies to, what's the common term for phalanges? Your fingers, okay? Now, the fingers are broken up into the phalanxes. You have the distal phalanx, you have a middle phalanx, and you have a proximal phalanx. Remember, we were discussing distal and proximal in our terminology a couple weeks ago? So proximal being close to the major point of attachment, distal being away from the major point of attachment. So the distal phalanx will be the tip of your fingertips, okay, or the tufts of your fingers. You will notice here that you have a distal, you have a middle, and you have a proximal from fingers 2 to 5. The thumb only has 2. The first digit, okay, which is the thumb, only has 2. It has a distal and it has a proximal. It doesn't have a middle. Okay? Now, the way the anatomy is discussed for each of the phalanges, so if we break it down, each of the phalanges has a head, the long part of it, which is the body, and the most proximal is going to be the base. In between each phalanx, you have the articulation, the joints, the articulation. So, for example, between the distal and the middle, and we're going to get to this later on, I'm going to introduce it to you now, between the distal and the middle, okay, is known as the distal interphalangeal joint, or the DIP, D-I-P. Distal interphalangeal joint, or DIP for short. We can say DIP. So if that's the distal interphalangeal joint, what is the articulation between the middle and proximal?
Proximal.
Proximal. The PIP, the proximal interphalangeal joint. Okay? So we'll talk about the fingers here in, later on a little bit. Now we've got the metacarpals. The metacarpals is the palm or the back of your hand. Okay, there's a total of 5. And then we'll talk about the carpal bones, which is what? What's your common term, common name for the wrist?
Wrist.
Carpals is the wrist. Okay, there's a total of 8. Okay, so you have your fingers, you have the palm of your hands, and then you have your wrist. All right. So here are the interphalangeal joints, as we mentioned earlier. Okay, in between the phalanges is the interphalangeal joints. From digits 2 to 5, you have a distal interphalangeal joint and a proximal interphalangeal joint. What happens to the thumb? Do you have a distal or a proximal?
Yeah.
There's just one. So it's just an interphalangeal joint. There is no distal or proximal. Okay? Because there's only 2 phalanges. Okay? 2 phalanges. Now, the articulation between the phalanges and the metacarpals is known as the metacarpal phalangeal joint. Metacarpal phalangeal joint. Is it easily found in your hand? Which is it? It's your knuckles. Okay, these are your knuckles. So that's the metacarpal phalangeal joint. And then the articulation between the metacarpals and the carpal bones is known as the carpal metacarpal joint. Carpal metacarpal joint. And then we'll talk about the carpal bones here in just a moment. Okay, any questions so far? So the question is, instead of writing the entire word out, can we abbreviate? The answer is yes. I would rather that you guys know what the abbreviations stand for. Okay, so you can do PIP, you can do TIP, you can do MCP, you can do CMC. But don't make up your own. All right, any questions so far? All right, so here we have an x-ray of the hand. What is the articulation between the phalanges called? Articulation between the phalanges. Interphalangeal joints. Okay, on digits 2 to 5. First of all, how do we know where to start? Is the pinky
The thumb
the
is
first
number,
digit
thumb
or
is
the
number
thumb?
one.
The first digit. It's
Thumb.
going to be the thumb. Okay? So digits 2 to 5. How many interphalangeal joints do we have there?
10 or 8.
Okay, on each digit. Two apiece, okay? What are they called?
Dip and pip.
Yeah, distal and interphalangeal joints. Okay. How many do we have on the first digit?
1.
1. Good. How many metacarpals do we have?
5.
5. Okay. We have 5 total. What is the articulation between the phalanges and the metacarpals called?
MCP,
MCP, or the
metacarpal phalangeal.
metacarpal phalangeal joints. And then the articulation between the metacarpals and the carpal?
CMC.
Carpal metacarpal joints. Very good. All right, any questions? All right, so here's a summary. You guys have the same handout here. So there are 14 phalanges in total. You've got 3 from digits 2 to 5, 2 on the first for a total of 14, 5 metacarpals, that's the palm of your hand, and then 8 carpal bones on your wrist. The total for the hand and the wrist is a total of 27. For just the hands only is minus the carpal bones is 19. All right, questions? Let's keep on going. So the assumption is, again, I go through the anatomy rather quickly, and I keep it very basic because you guys have already had anatomy, right? So this is just going to be review. I like to spend more time on the positioning part of it, so I kind of fly through this as quickly as I can. But if you do have any questions, raise your hands, okay? All right, so let's talk about the carpal bones, the wrist. The fingers and the palm of your hands are pretty simple. Let me go back here just a moment. Okay, we talked about the fingers having the distal part, which is, let's go back over here. Okay, so the most distal part is the head, then the shaft is the body, and then the most proximal is going to be the base. Same thing applies to the metacarpal bones, okay? So it also has a head, which is distal, middle is the body or shaft, and then the base is the most proximal portion of the metacarpal, okay? I think I forgot to mention that earlier. But the anatomy is the same in location. Head, body, base. Head, body, base.
For the phalanges, is it just the distal phalanx? Is it the head, body,
No,
base? Each of them have a head, body, and base.
Each of the phalanx will have a body, a head, body,
Okay.
and base. So this applies to each,
Okay.
including the distal phalanx.
You said the body's also the shaft.
We call it a shaft, but it's a body. The shaft applies more to the more longer bones, but we also call it shaft once in a while. Okay. You'll come to learn that a lot of these body parts have many terms for the same body part. Okay? All right. All right, so the carpal bones, starting with the most proximal row, okay? Here we have the scaphoid. When I say, and we're starting with the scaphoid, what is our baseline here? Why are we starting with the scaphoid and not over here on this side? Because of the thumb. Okay, this is going to be your first digit. So the most proximal on the thumb side is going to be your scaphoid. Another name for the scaphoid is the navicular bone. Scaphoid is also known as the navicular bone. This bone is most common in breaking when you're trying to break yourself from a fall. We see a lot of this injury from skateboarding and snowboarding. This is scaphoid injury. Next to that is the lunate. The lunate. Okay, you got 1, 2, 3, 4. Lunate. Third one here is the triquetrum or triquetrum. And the most medial is the pisiform.
Isn't that the one that's more noticeable on the anterior side, right?
Which one? The scaphoid?
The pisiform.
The pisiform?
Yeah.
It's one of those smaller bones. It's hard to see on an X-ray because it's so small and the way it's situated.
Isn't the position like more like right here, like on the front side of the palm?
Right here.
Oh.
Right about here.
Oh.
Yeah, it's right here, right here, but it's very difficult to break. The most common one is when you're breaking the fall, it's usually the thumb first. And that's the impact, point of impact is at the scaphoid. All right. The more distal row, again, starting with the thumb side, is the it's a distal, yes, the trapezium. The trapezium articulates with the first metacarpal, okay? Here's the articulation. Next one here is the trapezoid. So you have the trapezium with the thumb, trapezoid with the second metacarpal, then you have the capitate with the third metacarpal, and then the hamate articulates with two metacarpals, the fourth and the fifth. Now, this is going to be hard to memorize, but we have mnemonics, okay, and I think you guys got a handout with the mnemonics and how we can easily remember the different bones and the order of these bones. Okay, so here we are again. Now this is the palm the other way, starting with the thumb side. We've got the scaphoid, lunate. Okay, this is the pisiform, and then the trapezium, starting on that side, trapezoid, capitate, and then the hamate. 1, 2, 3, 4, triquetrum. Oh, sorry, triquetrum right here. I'm colorblind, so I'm not seeing two separate bones here. Are they different colors?
No.
No, are they one color?
Yes.
Oh, okay. So I'm saying I missed a bone somewhere.
Because the pisiform almost like sits on top of the
Yes.
triquetrum, right? Oh,
Yes.
Okay.
Yes. Okay. So here's the mnemonic again, starting with the thumb, most proximal, is the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. The most common one is send letter to Peter to tell him to come home. You guys like that?
It worked. She wants to say send letter to Paul.
I like these. Okay. Sally left the party to take Kathy home. Okay. I can attest to Sally taking Kathy home. She looks too pretty to catch her, and some ladies try painting their nails curious hues. And so long to Pinky, this is my most favorite here. So long to Pinky, here comes the thumb. And then last one here. Some lovers try positions that they can't handle.
I think that's the one I remember.
Oh, that's the one you can memorize?
Yeah.
Okay. Like so long to Pinky, here comes the thumb. All right. Well, if you can come up with a more better one, use it. Use it, okay? All right, any questions on the wrist bones? Okay. All right, here we have, this is not a common position that we do, but the way this is done, this is to visualize the base of the wrist, and it's usually done in this manner, like this, with hyperflexion of the wrist, okay, like this, and the tube comes in an angle this way, so it's an axial projection. So here we look at, you can tell where the thumb is because of the metacarpal. And based on the anatomy that we studied in the prior slides, which carpal bone is going to articulate with the thumb?
No, the
Scaphoid is most proximal.
the trapezium.
Okay, so it's going to be the trapezium. So you know what the thumb is, the next bone is going to be the trapezium. So if you know what the thumb is, you know the carpal bone articulating with it is going to be the trapezium. Now, going back to where you were, okay? If this is trapezium, if we're looking more proximal, this is going to be your
Scaphoid.
scaphoid. Okay? So on your thumb side, it's going to be trapezium and scaphoid. Trapezium, scaphoid. Okay, and that's what you're seeing there. The two bones that are projecting downward, one is the hamate, and the other one is going to be the pisiform. The other ones you can't see very well because there's some superimposition on there. But the four bones that I do want you guys to be familiar with in this particular projection is the trapezium, the navicular or the scaphoid, the hamate, and then the pisiform. Now this particular part of the hamate, it has a specific name for that. It's called the hamulus. The hamulus of the hamate. The hamulus of the hamate.
What were the bones you wanted us to know for this particular?
These right here. Trapezium,
Scaphoid,
navicular scaphoid,
hamate,
hamulus of the hamate, and then the
pisiform. So when you say hamulus of hamate, it's that bottom portion of
Yeah,
it?
it's kind of like a projection. It almost looks like a hammer sticking
Oh,
out.
okay.
When I say hamulus, I think of a hammer. That's how I remember it. All right, so here we have a PA wrist. Again, if we were to start at the most proximal, so let's not even look at this, okay? Let's do our mnemonics. Send, letter, lunate, to, triquetrum, Paul or Patty or whoever.
Peter
Okay, Peter, it's a pisiform. Okay, send letter to Peter,
to
trapezium,
trapezium,
tell him,
trapezoid,
triquetrum, I'm sorry, trapezoid, to tell him to come,
capitate,
capitate,
home,
home, which is
hamate.
hamate. Pretty easy, right? Right? Before I forget, the largest wrist bone here is going to be the capitate, which is G. It doesn't look at in this projection, but it is much larger than it is the scaphoid. Okay, you're going to do G. Now, when I was a student, the mnemonic that we learned, because we use different names. If you look back here at this particular slide, these were the names that we learned 20 years ago, which is navicular, semilunar, triangular, cuneiform, greater multangular, lesser rectangular, and also the os magnum and unciform. So we use a combination of all these different terms. So the way we learned it, do you guys remember Miss Greco? Okay. Now, what was it that she taught us? She told us. It's never, for navicular, she said it was never lower Tilly's pants, grandma may come home. Never lower Tilly's pants, grandma may come home. That's what we learned. Quite opposite of this similarist tripositions that they can't handle. All right, same anatomy here. This is called a radial deviation. The radial deviations are good for these bones here on the side. An ulnar deviation is your palm face down, going towards the, which way is the ulna? Towards the pinky or the thumb?
Pinky.
The pinky. How do we know that? Because the radius is on the thumb side, right? The radius is going to be on the thumb side. And how do we know that?
Because the radius radiates from the thumb.
Yeah, because remember, the radius, like the radial tire, it rotates. So it's always on the thumb side. That's how I remember. Okay, so the radius then is on which side? Which is the radius?
Left side.
This one, this one.
Left
This
side.
one here?
Mhm.
This is the radius. It's a much thicker bone. Okay. So this is called a radial deviation, which is palm side down, and you're deviating it towards the thumb side. Okay? So it's very good in looking at these bones here on the lateral aspect. So that includes the pisiform, you got the hamate, okay? The lunate in there as well. Okay, so these are all good for these particular bones.
Isn't it lateral deviation? Lateral deviation?
Well, okay, you can call it, okay, we're going towards the radius. Remember what I said, that you have different nuances, and sometimes the rules that we
So
talk
for the hand,
about,
it's palm
that doesn't
down,
always
right.
apply. So in this case, we don't call it medial or lateral deviation, we just say it's being deviated towards the radius.
Oh, okay.
Don't ask me why, but that's the way they do it. Okay, and then here we have the ulnar deviation. Ulnar deviation, so now that's a deviation towards the ulnar side, and this is a good position to evaluate the navicular or the scaphoid. All right, there's a slide on this, so you guys can look at that. It tells you exactly what we're looking at here. And then here we have the carpal view. Carpal tunnel view is what we call it. We know this is the thumb, so adjacent to the thumb is the okay, trapezium. Okay, next to trapezium, more proximal is the scaphoid. So it's right there, it tells you what it is.
Hamlet.
Okay, hamlets are the hamming, and then the
Pisiform.
Okay. Okay, here's a lateral wrist, adjacent to the thumb. Trapezium, okay, next one adjacent to the trapezium. Scaphoid. We didn't learn this one yet here, but this is the one that articulates with the ulnar radius.
And it
This
has
is the lunate.
And has that moon shape. So.
Yeah. Right. The other name for the lunate is semilunar.
Semilunar.
Semilunar, because it does have that crescent moon shape. All right, the joints of the wrist. So your interphalangeal joints are the ligaments or the hinge type. Again, I just added some pictures on here just so you have an idea of what a hinge is. And then the metacarpal phalangeal joints. Metacarpal phalangeal joints is the ellipsoidal or the condyloid type. The second through fifth carpal metacarpal joints is the plane or gliding type. And then the only one here on the hand that's a saddle or cellar type is the joint between the first metacarpal and the, trapezium. Okay, so this is a cellar or saddle type between the first metacarpal and the trapezium. Okay, any questions? Okay, let's fly through this. Joint classifications in mobility can be broken down to either functional or structural. If it's functional, a joint that is immovable is known as synarthrosis. Limited movement is amphiarthrosis, and freely movable is diarthrosis. Or we can also describe the joint in its structural formation, connected by a fiber, cartilage, or a synovial capsule type containing synovial fluid. This is where we're going to find in joints that are freely movable, like the shoulder and the knee joints and the hip joints. Okay? And then some more classifications of joints. Okay? It just, again, it's a summary of the previous slide that we had. So feel free to look through these, cruise through it. Any questions here? All right, the radiocarpal joint is the joint between the carpal bones and the radius. It is diarthroidal, meaning that it is freely movable, as well as condyloid structural type. Okay. Here you have ligaments that attaches these bones together. I put down here ligament, so you guys know the difference between ligament and a tendon. Okay, sometimes they're used interchangeably, and you shouldn't. Okay, a ligament is bone to bone, whereas a tendon attaches muscle to bone. In this case here, where we're attaching the carpal bone into the radius, it's a ligament. You have two different types. You have the ulnar collateral ligament on the ulnar side, and you have the radial collateral ligament on the radial side.
Are they called RCL and UCL?
You can say UCL and RCL, yes. And then in between the bones is a pad for cushioning and also lubricious movement is the articular disc. Okay. Now the joint between the radius and the ulna is known as the distal radial ulnar joint. So there is articulation with the bones of the forearm between the radius and ulnar. Most distal is known as the distal radial ulnar joint. So if there's a distal radial ulnar joint, there's probably a proximal too, right? All right, any questions? All right, so here's a picture of the ulnar deviation, okay, palm down towards the ulna. Here's one, radial deviation with palm down towards the radius. So for an ulnar deviation, this is going to be one of the most common positions and projections that you will see for the wrist is an ulnar deviation, and this is to evaluate the scaphoid. The radial deviation is not as common, but this is used to evaluate the hamate, pisiform, triquetrum, and lunate in a PA projection. It's a PA projection with a radial deviation. It's used to evaluate these four bones, the hamate, pisiform, triquetrum, and the lunate. Okay, but this one is more specifically for the scaphoid or the navicular. All right. Now, within the capsules, within the areas of these synovial joints, you'll find what is known as fat pads. Fat pads are important in making a proper diagnosis of any type of skeletal injury, because although you may not see a break, you may not see a break in the bone, doctors start looking for these densities where they are literally fat pads found within this synovial capsule of different joints. Okay? So if there's any type of deviation or break in these fat pads, it's a good indication that the bone had received some kind of trauma. Okay? And these fat pads, again, are located in all different areas where there are synovial joints or synovial capsules. Okay? Is any questions on that? They're called fat pads. So if there's a deviation or movement, or it looks like something's leaking out, okay, and you don't see a fracture in the bone, it's an indication that there is a fracture, you just can't see it. So they start looking for a break or movement of these fat pads. Now, because they are in liquid form, do you think we need to adjust our technical factors a little bit?
No.
Yeah, you said nasty. You said, yeah, because they're fluid. This is bone. Okay, so if you're using a bone technique, you're not going to see these pads. So what kind of technical adjustment should we make to visualize softer tissue?
Low contrast.
Lower.
Okay, you need to go down lower. So maybe lower KV. Okay, not black and white because we want something that's a little bit more gray to there. So we want short scale contrast. I'm saying long scale contrast. When lower KV, maybe adjust the mass a little bit so we can visualize soft tissue like this. See how we see soft tissue here, but we can't see it here? We see soft tissue here, okay, but we can't see it here. So we're going to decrease our technical factors a little bit better to visualize these fat pads. Good thing with computerized radiography is we can just take one x-ray and we just adjust our brightness and contrast with clicks and roll of the mouse, right? All right, let's look at this x-ray real quick. You guys see anything unusual? You guys have been focusing on the fat pads, but do you see anything unusual about this x-ray?
That line in the radius?
Ulnar.
I was wondering what that was.
That's a compression fracture. This is somebody who fell on their arm and the bone compressed, the shaft kind of compressed on one another, and now you have a compression fracture. Okay? Which bone is this?
The radius.
This is the radius, so there's a radial fracture going on in there. You guys can see that, huh? You guys were so focused on this. That's why magicians are so good. Sleight of hand, because you're focused on something else when they're pulling the fast one on you. Okay. Some more examples of where fat pads are located on the elbow. So they're kind of located all over the place. I don't need you guys to know the names of them or the location. I just need you to know that fat pads exist. Okay? And doctors will look at these fat pads sometimes to determine if the bone itself received some kind of trauma or injury.
So right there, we can't see them. They're just showing us where they would be
They're
located.
showing you where they're located.
Okay.
So for us to see soft tissue, we need to lighten up our technical factors a little bit better. So when we lighten up our technical factors, we'll see soft tissue, but now this is going to get washed out because it's lighter. We won't see bone, but we'll see soft tissue a lot better.
So